Hello and welcome to MD311 Medical PIC. In this session, we'll be discussing nursing care. By the end of this session, you'll be able to identify 5 nursing duties for every patient, list 3 elements of a patient care log, list 3 advantages to keeping a patient bedbound, and 2 major risks for the bedbound patient and how to prevent them, and perform a bed bath. Your role as a medical PIC is multifold. You have to be a clinician, you have to be a nurse, you have to be a lab tech. There are many things that you need to do. So, in the nursing side, one of the most important things you need to do is to prepare your aid room and have it always ready for any patient. Once the patient arrives, you need to assist them. If they are helpless or unresponsive, you need to undress them. If they're injured, you need to help them to get onto the examination table or into a chair, so you assist them to the most appropriate place when they arrive. You need to protect them from the environment, and that's throughout their care. You need to make sure that they have appropriate bedding or other appropriate coverings to protect them from the environment. You need to provide ways of getting rid of stool and urine, be that a urinal or urinary catheter, bedpan, bedside commode, or assisting them to the bathroom. Once you've fed a patient, you need to get rid of their used plates, their used utensils as quickly as possible to prevent creating an environment that promotes infections. And you need to limit patient visiting times, which can be tricky depending on your role, shipboard, your position in the chain of command. But as the PIC, for these patients, you have the authority to promote their healing as best as possible. So that includes limiting all visiting times, and it's best to really have a set of published visiting times. Make sure that people on each watch can have an opportunity to visit the patient, but make sure that those visiting times are enforced. So there's some very basic principles of nursing. One is that you make sure that the patient's comfortable in the bed while you're caring for them. And you need to keep a log of their care. And this is separate from their medical note, their SOAP note, or medical progress notes, although you can put them together in the same log because you're playing a single role. But these are nursing notes. And so on every page of your log, you have the patient's name. You write your note, and you're basically writing what nursing things that you did. Ins and outs, how much they took in, how much they put out, what activity they did, any nursing type findings, and you time, date, and sign every one of your notes and print your name so everyone knows who wrote the note. And that's your progress note for the patient. And that can be combined with your medical progress note. Again, you're one person doing all of this, but make sure that you're keeping the log accurately. And then you need to check vital signs at least 3 times a day, and if you have an ill patient, it may be as often as every 5 to 10 minutes. Now, why do we keep patients bedbound? Well, the more you're laying still, the less energy you're using. The less energy you're using to do silly things like walk around when you're sick, the more energy you have to cure yourself. If you've ever watched kids who get the flu or some other viral illness in the fall, what do? They go to bed, they sleep for 30 hours, and they get up and they're fine. What do adults do? We push through work, we push through school, and we're sick for a week or two. It's because kids' bodies are smarter than we are as adults, and the kids' bodies make them sleep so that they can focus all their energy on healing. If someone's injured, being bedbound immobilizes them, particularly if you tell them not to move. So a patient who has a spinal fracture or a leg fracture, if they are in bed at bed rest and aren't moving, that decreases pain and discomfort. It immobilizes the injury. It makes the patient feel better. But being bedbound isn't all sunshine and happiness. When you're laying flat in a bed, you develop pressure areas, and if you don't move, your skin will break down. Now, if the patient is at all awake and alert and they can move slightly, I mean, we all sleep, right? But if they can move slightly, they'll prevent that skin breakdown. And that's what we do at night when we toss and turn. Most people don't stay in one position the whole night. Your patients can do that. But if they can't, then you're going to need to change their position, to roll them, to relieve pressure from pressure points so that blood flow can return there and they don't get skin breakdown and ulcers. You may need to also put protection over areas that are notorious for breakdowns, particularly the heels and the decubitus area right at the top of the buttocks. And of course, your patients can get clots in the legs, deep vein thrombosis, which results in a pulmonary embolus, a clot to the lung. And so there are stockings that can be put on to improve venous return to the heart, but even those aren't great in a totally immobile patient. In the hospital setting, we would start them on shots of blood thinners. For you, you're going to need to massage their legs regularly if they can't move them at all. By massaging the legs, you promote venous blood return. And so if you have a completely unresponsive patient, you're going to need to do that to prevent clots from forming in the legs. You need to take care of your patient's skin. If you don't take care of the patient's skin, it will break down. They will end up with infections. They'll end up with permanent damage. So you want to do things that enhance skin circulation. Keep the skin clean and dry. And things that are going to help you do this: turn the patient every 2 hours if they're unresponsive. That will also actually help with a venous return in the legs, so that decreases your chance of a DVT and a pulmonary embolism. Don't leave patients on wet surfaces. If the bed is wet from sweat, from urine, because the patient spilled a cup of water, change the bed. Do a complete bed bath daily. That promotes skin circulation, it keeps the skin clean, it prevents areas of breakdown, and clean the face, the groin, and the axilla 3 times a day in an unresponsive patient, or in a patient who can't keep themselves clean, because those are areas that tend to be problematic as well in terms of keeping them clean. Now, who would have thought this, but the mouth is a huge source of infection in the patient themselves, and so we need to keep the mouth clean. We actually find that if we have patients in an intensive care unit that have a breathing tube in and they're on a ventilator, they get much less problem with pneumonia and other infections if we brush their teeth. So mouth care is critical, particularly in your unresponsive or helpless patient. So you want to keep the mouth clean and moist. So if they're able to take oral fluids, then they should be able to drink. If they're NPO, that is, they're not allowed to eat or drink anything, they have a bowel obstruction, they have a fracture, you're giving them IV fluids, and they're going to need to go to surgery as soon as you can evacuate them, then you can do swabs to swab the mouth with water, or ice chips are typically considered acceptable. And brush their teeth, preferably twice a day, after every meal, at least once a day, but make sure that you're routinely brushing their teeth, which will decrease their risks of the mouth being a source of infection for them. Now, bed baths are something that's going to be new to anyone who's not done nursing care, and they're a very useful thing for promoting your patient health if you've got your patient for an extended time period. So it cleans the skin, and as you clean, it actually enhances circulation. It causes the blood vessels to dilate, the capillaries to dilate. You get increased blood flow to the skin. That's healthy for the skin. While you're doing the bed bath, you're looking for skin breakdown. You begin to look for hot areas where you're starting to see a little bit of redness. Not true skin breakdown yet, but contact areas where you see redness. Those are very concerning, and you need to protect those. And you mobilize their joints so the joints don't stiffen up and freeze, which can be a real problem for people who are in bed for a long period of time. So how do you do this? Well, you start in a clean area, you clean a first area, and then you work out to other dirty areas. You don't jump from dirty area to dirty area. You want to rub vigorously. That's going to increase that circulation to the skin. Use just a little bit of soap. You don't need a whole lot. just a small amount. And in fact, there are bath in a bag type products that come out that have the right amount of material in, that you microwave them, they have everything in that you need, and those can be very useful for this. Use warm water, use very minimum shampoo. You're not trying to froth up their whole head, you're just trying to clean the dirt out, and they're not doing a lot to get dirtier. Wash one area at a time, so don't go over the whole body, but focus on one area, get that clean, move to the next area, get that clean. You want to change the bed after the bath because you're going to get the bed wet, and you don't want to leave your patient lying in that wet, dirty linen after you've given them this bath and they're nice and clean. And clean their clothes afterwards, so their bed clothes, change them as well once you've given them their bed bath. And the bed bath is just an amazingly effective tool, both in promoting health because of cleanliness, but also as a psychological treatment. To be clean when you're sick is a wonderful thing, and this will help your patient much more than you could possibly imagine. Please complete any knowledge reviews associated with this session, and if you have any questions, don't hesitate to contact your instructor or professor. Thank you.